connective tissue and different type of classifications. One type of classification is that long bone, short bone, long short bones, pneumatic bones, sesamoid bone, accessory bones, etc. Another type of classification based on the ossification, membranous bone, cartilaginous bone, membranocartilaginous bone. And there are another type of classification, appendicular bone and axial bones. So different ways we classify different bones, of which most important in our body, all bones are important, but mostly the long bones. And there is an often, I already told you, I tell the important questions of the general anatomy that may come in your examination. Usually two questions are usually come. One is to describe the part of a young long bone or adult long bone with level and its blood supply. This is the most important part, comes in the theory. So, how do you describe bones? Operate. A long bone, you know, as I have repeatedly told you, has got a upper end, lower end, and in between there is a shaft. Janito, it is the criteria, one of the criteria for long bone. So, I am now described a young long bone. Before going to the description of young long bone, just give about 2 to 3 lines about the ossification. You know, ossification starts in the fetal life. First, ossification means according, I have already told you, that bone, first in our body, there is a mesodermal tissue. You will learn in your embryology class, cells with enough intercellular substance, we call it mesodermal tissue. This, in some bones, this mesodermal tissue, in the mesodermal tissue, there is a development of cartilage producing cell. And suppose here, this mesodermal tissue, a cartilage cells produce cartilage here. And according to the final outcome of the bone, they produce a model, more or less, a model of that bone. Exactly not, exactly more or less long bone. Suppose they produce the humerus. The model will be like that. And this is the cell known as the cartilage producing cell, known as the chondroblast, which producing cartilage. And model is like that. And then here, the mesodermal tissue contains to form, the model is like that. Membrane-like structure, connective tissue, membrane-like. No cartilage cells are present here. So, what we have learned, there are two types of ossification. One, cartilage model is there. There are cartilage cells producing cartilage like this. And here, where the flat bones will produce, there is a membrane-like mesodermal tissue condensation. And about 7 to 6 clavicle, the first ossification, it is an exception. About 5 to 6 weeks of life, there starts first ossification, ossification comes here. What is ossification center? Means cartilage model has got a blood supply. And there is a covering wrapping perichondrium, and there is a blood supply coming here in this fashion, and they divide. This blood carries some bone forming cell. Cartilage cell, we call it chondroblast, can produce cartilage. Similarly, bone forming cell coming through the blood and first rest here. They rest here. And these bone cartilage here gets destroyed. Not cartilage cell converted into osteoblast. I repeatedly told you, chondroblast is not converted into osteoblast. Osteoblast is a separate cell coming from outside to come in the middle of this sac of the future long bone. We call it osteoblast forming cell. These osteoblasts now produce, this is the osteoblast. These osteoblasts now produce intercellular substance like a bone, and also calcium is deposited here. That's when first bone is formed here. And we call it primary center of ossification. It occurs in the fetal life, usually 7th to 8th week of fetal life. We call it primary center of ossification. And they ultimately, gradually bone is forming here in this fashion, grows here, grows here, grows here, grows here. Cartilage are destroyed and bone is now produced on the two sides. Ultimately, it reaches more or less the end part of the bone. But at the end part of the bone, still the cartilages are present here. It is not converted into bone when the baby is born. And the baby is now born. Gradually bone is increasing in length. You can ask me, then how the baby's bone is so small, but our bone is not only in length, it is increased, but also in girth, in breadth, it is also bigger. How they become bigger? In this fashion? No. When this bone is formed, this perichondrium is replaced by another membrane, we call it periosteum. We call it periosteum. Periosteum is like that. Suppose it is a bone, periosteum is covering the bone in this fashion. And this, look, this bag has got a 2 layers, 1, 2. Similarly, periosteum also got a 2 layer. Outer layer consists of fibrous tissue, blood vessel, etc. And inner layer containing bone producing cell, osteoblast, also bone destroying cell, osteoclast, etc. So periosteum has got a 2 layer. আমরা যদি এটাকে বড় করে আঁকি, if we draw this periosteum larger, what we see, it is the bone. Periosteum has got it. This is the periosteum, inner layer and an outer layer. This is the inner layer, outer layer, sorry, and this is the inner layer. Whole is the periosteum. Inner layer of periosteum we call osteogenic layer. Osteo means bone, genic means can produce. Because these inner layer, here lies the bone producing cell known as the osteoblast. And outer layer is a fibrous tissue. We call it fibrous layer. So periosteum consists of two layers, cytogenic layer or osteogenic layer and a outer fibrous layer. This osteogenic layer can produce bones, and bone is increased in girth, increased in breadth. So, length is increased by the ongoing process of primary center of ossification, and breadth is produced by the periosteal osteogenic layer. So, in this way, bone is increased gradually and baby is born. But at the extreme end, it becomes cartilaginous. Right? Now, after birth, about 1 year, in some bone 1 year, in some bone 2 year, in some bone 4 year, in some bone 5 year, etc. Due to the pressure effect, due to the pull of muscle, another center of ossification produced here. It is also a cartilaginous model there, produced here. And they produce bone. After birth, it may be 1, it may be 2, it may be 3. In some bone, there may be 1 above, 1 below. In some bone, above 3, above 4 in humerus. Right? We call it secondary center of ossification. We call it secondary center of ossification, and they produce bone. Suppose if it is a humerus, first they born in this fashion. This is a cartilaginous model. So this part is cartilage. This part is cartilage. This is also cartilage. Kokhon? At the birth. After birth, for example, humerus, it bears pressure. Abhi bolechi. Head of the femur, upper end of femur, it bears the weight. To resist this pressure effect, this cartilage is a resilient, not hard like a bone. So, new bone must be there to resist or transfer this pressure. So, the new center of ossification starts here. And this is bone is produced here. So we call it secondary center of ossification. As this occurs due to transmission of pressure, these epiphyses we call pressure epiphyses. We call it pressure epiphyses. So upper end of or head of humerus is a pressure epiphysis. Now already you know some muscles, iliopsoas muscle, subscapularis inferior muscles are attached in the close to the head. The muscle pulls. Always when this muscle act, this muscle make a tractional force. Pull means produce a force. It produces a force. When you pull something, it produces a force. with traction, we call it tractional force. So due to this tractional force, after birth, new center of ossification produced here and a form bone. One is larger and one is smaller. And this is example of traction epiphysis. And example is greater tubercle and lesser tubercle of humerus. Other example are also there, femur, trochanter, etc. are there. Infibula styloid process is an example of tractional epiphysis. So epiphysis has got a different, there are other two types of epiphysis, I will come later on. That is the bolo keu jano? Atavistic epiphysis and aberrant epiphysis. Pore asbo. Tahole eta gelo secondary center of ossification. So these become bone, these become bone, these become bone. But this part, more or less up to adult period, 17 to 19 years, depending upon the bone, a plate of cartilage is present here between the epiphysis and the between this epiphysis and the diaphysis. A plate of cartilage is present here. This is the epiphysis. This is the diaphysis. A plate of cartilage is present here. A plate of cartilage is present here. We call epiphyseal cartilage. We call epiphyseal cartilage. Epiphyseal plate of cartilage or epiphyseal cartilage. Baby is growing, almost reaching to puberty, and so there what's happened? For example, 14 to 15-year young boy or young girl, there is a bone produced from the primary center of ossification. We call it diaphysis. A bone produced from the secondary center of ossification, we call it epiphysis. In between them, there is a plate of cartilage. We call epiphyseal plate of cartilage. Clear? The boy or girl is more, age is advancing, reaching 19 years, 20 years. Gradually, these epiphyseal cartilage, all first in one end, it becomes bone. And after 1 to 2 years, suppose these is also become bone and continuous bone is produced. Like that. There is no cartilage in between. Continuous. So it is above to, depending upon the bone, we can determine the age. So it is the adult bone. And what we describe? Young bone. Young bone means till epiphyseal cartilage is present. Describe a young bone and describe its parts. How to answer? Long bone introduction. 1 to 2 lines. Long bone has got a 2 ends, upper end and lower end. And in between shaft. Between 2 ends and shaft. The shaft develops from primary center of ossification and ends develop from secondary center of ossification. Introduction says. Next, parts of a long bone. Ever you draw a picture and label it. Shaft or diaphysis. Epiphysis. Complete. এরপরে in the central part of the shaft there is a long cavity we call medullary cavity. Medullary cavity. Another thing, a part of the diaphysis, it is a part of the diaphysis. A part of the diaphysis, it is a part of the diaphysis close to the epiphysis. A small part of the diaphysis close to the epiphyseal cartilage. We call it metaphysis. অনেক আমরা দেখেছি লেখে এইটাকে মেটাফাইসিস বলে। নো, মেটাফাইসিস ইজ দ্য epiphyseal end of diaphysis. Metaphysis is a part of diaphysis, upper or lower end, close to the epiphyseal cartilage. এটাকে আমরা বলি it is a bone metaphysis. An upper end of a long bone usually articulating and again covered by a cartilage. Usually hyaline type of cartilage. As the upper end usually form a bone, form a joint. So upper end is also covered by a cartilage. Usually, agei bolechi exception de, usually covered by a hyaline cartilage. And this cartilage is known as the articular cartilage. Don't miss conception about the articulating and the epiphyseal cartilage. Articulating cartilage is covering the articulating area of the bone, and epiphyseal cartilage present only in the young persons between the epiphysis and the diaphysis. So articular cartilage is another cartilage which is also present in adult also, and this area, smooth area, is covered by a cartilage. We call the articular cartilage. This area is covered by a cartilage. The smooth area we call the articular cartilage. Epiphyseal cartilage only in present in lung. তাহলে এই ফিগারটা আঁকবে আর এইখানে পেরিঅস্টিয়াম লিখবে। It is the part of a long bone. কেমন? এই ছবিটা আঁকতে হবে। আর যদি বলে অ্যাডাল্ট তাহলে কোনটা সবই থাকবে, কোনটা চলে যাবে? Which will vanish? There is a no epiphysis cartilage, epiphyseal cartilage. So adult হয়ে গেলে otherwise all are same. তাহলে এইটা একটা কোশ্চেন দেয়। এরপরে অনেক জিজ্ঞেস করে এই টাইপ, এই যে এখানে বোনস রয়েছে ফ্রম দ্য প্রাইমারি সেন্টার অফ অসিফিকেশন, দিস বোনস আর ভেরি ডেন্স লাইক এ আইভরি। উই কল ইট কম্প্যাক্ট বোন। উই কল compact bone, and here at the ends from the epiphysis bones spicules are arranged like that. We call cancellous or spongy bone. In compact bone, medullary cavity or bone marrow is present here in the central part. In spongy bone, marrow substances are present in between the plates. These are the marrow. What is marrow? Marrow is a special type of connective tissue, and most important, within this marrow there is a blood forming cell. They produce red blood cell, WBC, etc., platelet, etc. When the baby is born or in fetal life, all the marrow looks red. And all these area, medullary cavity, these, all can produce blood cells, better term, blood cell, RBC, WBC, etc. And as RBC is there, they look red. We call red bone marrow. But when this baby is growing and become adult, gradually this medullary cavity is replaced by fat cells, fat tissue, adipose tissue. Another name of fat tissue called adipose tissue. It is usually fat is yellowish in color. You can see that in your when the meat shop, the fat is yellow in color. So this marrow gets yellowish. We call adult yellow marrow, the red marrow. They contain very few blood forming cell. So in adult, this medullary cavity is not the site of bone forming, but in adult also, these marrow are also remain red and they produce blood. So in adult, in fetal life, whole marrow cavity and here also they produce blood cells because the red marrow is present. But in adult life, only ends can produce blood cell. Plus, some of the bones they produce in adult in blood cell, of which the vertebra, ribs, these flat bones of the skull, they can produce blood cell. Right? And another important with this classification, liver is a very important organ of blood formation, hemopoiesis. You will learn in the physiology also. তাহলে হয়ে গেল আমাদের একটা আইডিয়া। এরপরে নেক্সট কোশ্চেন আসবে, ইম্পর্টেন্ট কোশ্চেন। রাইট এ শর্ট নোট অন দ্য ব্লাড সাপ্লাই অফ এ লং বোন। ব্লাড সাপ্লাই অফ এ লং বোন, এই দুটো কোশ্চেন ইউজুয়ালি দেয়। আচ্ছা, আমি একটুখানি ওই বিফোর গোয়িং টু দ্যাট একটু এপিফাইসিসটা কমপ্লিট করে নিই। Epiphysis is a part of a bone which develops from secondary center of ossification. And there are 4 types of epiphysis: pressure epiphysis, traction epiphysis, atavistic epiphysis, and aberrant epiphysis. Pressure epiphysis. Obviously, you know, due to pressure effect, this epiphysis is formed, like head of the humerus, this capitulum, trochlea, head of the femur, all are example of pressure epiphysis. Traction epiphysis, where the epiphysis is formed due to pull of the muscle, greater lesser tubercle, greater lesser trochanter, styloid process of fibula, all are example of traction epiphysis. এবারে একটা কথা বলে নিচ্ছি এখানে, When in a bone, whether in a long bone, in a bone, for example, humerus, look where both pressure and traction epiphyses are present. Both pressure and traction epiphyses are present. And there are some law of ossification, bone forming, primary center of ossification, appearance of primary center of ossification, when the secondary center of ossification will come, when the epiphyseal cartilage will develop, disappear, when the epiphyseal cartilage will disappear, there is in some rules and call it laws of ossification. As one. কি বলে? Laws of ossification. আসবো আমি তার মধ্যে একটা not so important তাও একটা this rule is that when a single bone both pressure and traction epiphysis appears means secondary center of ossification. I have already told you not all secondary center of ossification comes in same time. Suppose it is 1 year, it is 4 years, it is 6 years or 10 years, etc. When a single bone, both pressure and traction epiphyses are present, pressure epiphysis will appear first, then the traction epiphysis. মানে এইটা আগে appear করবে, তারপরে এগুলি appear করবে। এটা যেন মনে থাকে কি করে কখন লাগবে? All the laws of ossification is okay in all bones in our body except fibula. Fibula violates the laws of ossification. কিন্তু আমি বলি fibula আরো strictly maintain the laws of ossification. আসবো আমি পরে। Very interesting. তাহলে একটা কি ল শিখলাম? When in a bone both pressure and traction epiphyses are present, pressure epiphysis will appear first, then the traction epiphysis. Right? একটা ল শিখলাম, বাকি ল আসবো পরে। নেক্সট হচ্ছে ব্লাড সাপ্লাই। Periosteum here is continuous with the joint capsule of the joint. So this is the periosteum, this is the medullary cavity, this is the sac, this is the epiphysis. And now blood vessels are there. From the heart, branches coming and goes further branching, ultimately it branches close to the joint, bone joint also. এবার খুব ভালো করে শোনো। So surrounding arteries are there. Suppose this is an artery which carries blood. This is another artery. 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 Branches of the arteries. From an important artery, for example, here in the brachial artery or arteria profunda brachiae, a branch comes out, small branch comes out. Initially it become tortuous. Tortuous মানে কি এরকম, এটাকে কি বলি tortuous. Then it pierces the periosteum and entered the bone. To reach the central part. Then it divides into an number of upper and lower branches. We call it nutrient artery. Nutrient artery may be one, more than one also. Usually one. কি বলি এটাকে? Nutrient artery. Why nutrient? Because it gives nutrition, food to the bone. এখানে একটা this nutrient artery then goes giving parallel branches and goes towards metaphyses. This is the metaphyses. This region is the metaphyses. What I am describing in young bone, where the epiphyseal cartilage is still present. Young, 10 year, 11 year, 12 year, 13 year, 14 year, 15 year. And close to the metaphyses, এটা খুব ভালো করে শোনো. These branches become looped and ends by supplying the region. So এই জায়গাটা যদি বড় করে আঁকি কি দেখব? শেষ হয়ে গেছে। আর্টারিগুলি এরকম। It looks like a hairpin of a lady. Hairpin. Previously they used U-shaped. So we call it this type of artery. We call hairpin bend. Bend মানে বেঁকানো. So these branches of the nutrient artery reaches the metaphyseal end and close to the epiphysis. It makes a hairpin bend and ends here. In young, and each branch is an end artery. এইবার একটা টার্ম শিখলাম, নতুন টার্ম end artery. What is end artery? Suppose it is a tissue. Suppose it is an intestine, a part of the intestine, a part of the stomach, a part of the heart, whatever it may be, part of the liver, etc., kidney. A branches of artery, a big branch, number of artery arises and supply. এই পার্টটা, this supply this part, right? What is the normal course of an artery? Artery goes, ultimately divides into branches, smaller branches, more smaller branches, then breaks up into fine reticular network we call capillaries. All of you know. From the capillaries, vein starts. From the capillaries, vein starts. Right? এইখানের পরে ক্যাপিলারি হবে এবং ভেইন স্টার্ট হবে এবং ভেইন বেরিয়ে আসবে। তাহলে কি দিস ব্রাঞ্চ অফ আর্টারি সাপ্লাই দিস পার্ট অফ ইন্টেস্টাইন, দিস ব্রাঞ্চ অফ আর্টারি সাপ্লাই দিস পার্ট, দিস সাপ্লাই দিস পার্ট। সাপোজ ডিউ টু সাম রিজন দিস আর্টারিজ are blocked. Very commonly small arteries are always blocked in our body every time, but it has been removed by your anticoagulant system. But sometimes we fail. Suppose these arteries are blocked. Can any blood go to this area? Can go? No. As this part is blocked, blood cannot go, they stop here and cannot go. So this tissue will deprive of nutrients, oxygen, etc. Ultimately, this part of the intestine will die. Very bad situation. কিন্তু হচ্ছে না তো, তাহলে কেন হচ্ছে না? Because before going to the capillary, for capillary, there is an communication between the adjacent arteries. Look, there is a branching communication with the adjacent artery. Right? So even this part is blocked. This can go blood, this and supply this. As this communication is before the capillaries occurs, before the vein formation, capillary formation occurs, we call it pre-capillary anastomosis. We call it pre means before, post means after. As this communication, এইখানে এসে capillary হবে. As this communication occurred before the capillary formation, we call it pre-capillary anastomosis. So, in this situation, there is a pre-capillary anastomosis, so that even this is blocked, the neighborhood artery can supply this blood. But if this capillary anastomosis is not there, so এই শুধু এইটুকুনি জায়গায় সাপ্লাই করবে, এক্সেস ব্লাড নেই, so this part will die. So we call it, there is a no pre-capillary anastomosis. অথবা আরেকটা হতে পারে, এইখানে সবচেয়ে যেটা ভালো এক্সাম্পল, ক্যাপিলারির আগে এইখানে অ্যানাস্টোমোসিস হয়. Even this part is blocked, this blood can go and supply this. It is a better example. আগেরটা ঠিক নয়. Pre-capillary anastomosis, ক্যাপিলারির আগে হয়েছে. So even this part is blocked, no blood, but this blood can travel this and supply this. কোথায় block? So luckily we have got pre-capillary anastomosis more or less everywhere except few. Obviously dangerous is the central artery of retina. And we call these arteries which has got no anastomosis, pre-capillary anastomosis between the adjacent artery, we called end artery. We called end artery. We called end artery. So if end artery is blocked, if there is a no pre-capillary anastomosis, if end artery is blocked, means no blood is there and this part will death. Intestine ওখানে ফুটো হয়ে যাবে, হোল হয়ে যাবে, and intestinal content may come out. Dangerous. Peritonitis, we call intestinal perforation. হার্টের ক্ষেত্রে তো আরো ডেঞ্জারাস. হার্টে কিন্তু প্রিক্যাপিলারি অ্যানাস্টোমোসিস রয়েছে, কিন্তু দে আর ইউজুয়ালি ফাংশনলেস. পরে শিখবে, এখন ছেড়ে দেব. Best example is the retinal supply, central artery of retina, which has got no pre-capillary anastomosis. So that if it is blocked, central part of the retina is blocked and we are getting blind. Dangerous. So the importance of this conception of end artery. So we call central artery of retina is an end artery. Similarly, in young bone, these are end artery. এটার ডেঞ্জারটা কি? দুটো ডেঞ্জার. একটা হচ্ছে if it is artery straight, well calibered, flow of the blood is very good. Suppose it goes 20 meters per second. Flow of the blood is very good. বড় নল হু করে ব্লাড যাচ্ছে. But if there is a bend and becomes stop, the blood flow get reduced. blood flow, velocity of the blood gets reduced, কমে যায়। তাহলে ডেঞ্জারটা কি? ডেঞ্জার হচ্ছে if in your any small river or small canal in your locality, you see, if the blood flow is reduced, there is an accumulation of mud, etc. Because flow is reduced, they cannot move away the mud and they get accumulated. Similarly, we are always challenged by the bacteria, and bacteria is moving in our blood. Sometimes a tissue becomes dislodged and moving, blood clot moving in our body. We call it thrombus or embolus. It may be a bacterial embolus, a clump of bacteria is moving in the blood. Suppose the flow is good, the bacterial embolus is also moving very good, goes moving away very fast and go to the, for example, spleen or lymph node, they become captured and destroyed. But here the flow is loosed. This bacterial clump of bacteria may be slowed down and may locate and stop here their movement, and we call it lodge here. Lodging নিয়ে নিয়েছে, হোটেলে চলে গিয়ে বসে গেল, we call lodge here. Ultimately they produce infection. These bacteria can proliferate and produce infection, and any bone infection we call it osteomyelitis. In bone infection, the name of appendix is when inflamed. When the inflammation, pathology শিখবে, physiology to you learn, when the inflammation may be due to anything, chemical injury, bacteria, virus, so many cancer may produce inflammation. Certain changes occur in our body. We call it inflammation. Not actually try to make it is a good for us, but sometimes when it is excessive, it becomes very painful and very bad. So appendix is when inflamed. What is the common name of inflammation of appendix? Appendicitis. When the gallbladder, Latin name হচ্ছে cholecystitis, so gallbladder is inflamed, we call it cholecystitis. Similarly, here is the osteomyelitis. So there is a chance of osteomyelitis in the metaphyseal area in the young adult, young bone or young person. তাহলে কোশ্চেন আসবে, explain why the osteomyelitis is common in young, not in adult. Where it is common? Sir, metaphyseal area. Why? এইখানে বলতে হবে, it becomes a loop, hairpin end, bacterial embolus can lodge here and produce infection. As this area is in the metaphyseal area, so involvement, bone inflammation is very common in metaphyseal area, and metaphyseal area is very close to any joint. So it is the metaphyseal area, it is close to a shoulder joint, so easily this infection can involve the joint also. Joint inflammation এর আমাদের medical term হচ্ছে arthritis. So very common, arthritis is also common. তাহলে খুব ডেঞ্জারাস, ইয়ংদের ইমিডিয়েট ট্রিটমেন্ট ইজ নিডেড। তাহলে ফার্স্ট হচ্ছে একটা নিউট্রিয়েন্ট আর্টারি, এরপরে নিউট্রিয়েন্ট আর্টারির একটা এক্সপ্লেন হোয়াই কোশ্চেন বলে দিলাম, 4 নম্বর করে থাকে, 4 নাম্স আর গিভেন is explain why, 5 questions are there, each carrying 4 marks, so it is very important. Explain why. Number 1, why the bone osteomyelitis is common in young adult. You have to answer this according to the blood supply and also about the metaphyseal area. Next question from the nutrient artery. Why it is tortuous? Because always bone is always moving. So if it is not a tortuous, it becomes stressed and can be torn. Tortuous থাকার জন্য, like elastic, it can increase in length so that it cannot be stressed on. ছেড়ে দাও। নেক্সট কোশ্চেন ইজ দ্যাট, ভালো করে শোনো, আমি এই জায়গাটায় কি এঁকেছি, একটা কায়দা করেছি, দেখো নিউট্রিয়েন্ট আর্টারি এন্টার্স, আমি এরকমও তো আঁকতে পারতাম, আই ক্যান ড্র ইন দিস ফ্যাশন অলসো। একদম রাইট অ্যাঙ্গেল দুটো ভাগ আঁকিনি, আমি কি করেছি, একটা আপার এন্ডের দিকে ডাইরেকশনটা মোড়, লোয়ার এন্ডের দিকে কম, এরকম করেছি, তারপরে ডিভিশন করেছি। রাইট, বুঝতে পারছো কি? and nutrient entity direction যদি বোনসে দেখো, it looks like that, it is directed in one region, either upper end or a lower end, and direction দেখে বুঝতে পারি, so it is a common, the blood is coming and blood flow is more in this direction than in the lower region. ভালো করে বোঝো এটা, the nutrient artery is directed here upper, towards the upper end. The blood flow is more in the upper end than in the lower end. If the nutrient artery is the direction is here, blood flow is more in the lower end than in the upper end. What is the importance knowing that? Very important, laws of ossification. So blood supply here is more in the upper end than the lower end. Here, blood supply is more in the lower end than in the upper end. যেদিকে ঢালু সেদিকেই তো যাবে, so it is more in the lower end than the upper end. Here is more in the upper end than in the lower end. And in which direction blood flow is more, the epiphyseal cartilage will disappear earlier than the leaf. That's mean bone matching. Bone formation, secondary cartilage, epiphysis joins with the diaphysis earlier. ব্যাপারটা বোঝো, এইদিকে মোর, so these cell become more blood supply, so খাওয়া দাওয়া হয়ে গেছে, more food is getting, they mature fast, they become bone fast, ultimately joins with the completes its cycle and joins with the epiphysis fast. রাইট, এইখানে লেস, গরিব ছেলে পুয়োর খাবার পাচ্ছে না, দেখবে ওর ম্যাচুরিটি পিউবার্টি আসতে দেরি হচ্ছে, এরকম এক্সাম্পল। সো দে জয়েন্স উইথ দ্য এপিফাইসিস লেটার। তার মানে কি হলো, ইট ইজ দ্য ডাইরেকশন অফ এপিফাইসিস, তাহলে towards the direction of epiphysis, it joins, the epiphysis and diaphysis joining is earlier. আগে বলেছি, suppose it appear, একটা example, it appears 1 year, এটা appear করেছে 5 year, and direction of the nutrient foramen is like that. না সরি, উল্টোটা হবে, এইখানের ক্ষেত্রে পরে আসবো, এইটা ধরো 5 year, এইটা 1 year, পরে আসবো, আজকে আর হবে না, 5 year and 1 year, কেমন? এবার কোনটা আগে জয়েন করবে, এইটা না এইটা? ডাইরেকশনটা আগে দেখবে, ওই সব দিকে তাকাবে না, ডোন্ট লুক দিস এ ওয়ান, ডাইরেকশনটা কোথায়, টুয়ার্ডস দ্য আপারে, তাহলে এইটা কখন জয়েন করবে, আগে না পরে? এই শিওর হয়ে বলো, বলো, আগে। ডাইরেকশন অফ এপিফাইসিস ইজ লাইক দ্যাট, এইখানে এপিফাইসিস হয়েছে, এপিফাইসিয়াল কার্টিলেজ রয়েছে, আর নেই কালার, ধরো দিস ইজ এপিফাইসিয়াল কার্টিলেজ, এখানে এপিফাইসিয়াল কার্টিলেজ, কোন এপিফাইসিয়াল কার্টিলেজ ডিসঅ্যাপিয়ার আগে করবে, এই দিকে যাচ্ছে ওপর দিকে, এটা না এটা, ও বললো আপার, তুমি আপার, তোমরা পেছনে আপার, রাইট, আপার, আপারিং। আর যদি এটা এরকম হতো তাহলে এইটা আগে জয়েন করতো, কেমন? যেদিকে নিউট্রিশন ফোরামেন ডাইরেকশন, ইট উইল জয়েন ফার্স্ট। এবার নিউট্রিয়েন্ট ফোরামেন ডাইরেকশন কি করে মনে রাখবো? এই হাতের আর পায়ের ক্ষেত্রে একটা জিঙ্গেল রয়েছে, দেয়ার ইজ এন জিঙ্গেল। টুয়ার্ডস এলবো আই গো, ফ্রম নি আই ফ্লি। ব্যাপার কি হলো? এইটা হাত দিয়ে দেখো, নিউট্রিয়েন্ট ফোরামেন আর্টারির ডাইরেকশন, towards elbow I go, I means the artery, I means artery, so towards elbow I go, so humerus in case of, এখানে কি বোন রয়েছে? humerus, আর এখানে radius and ulna, towards elbow I go, মানে direction of nutrient artery is towards the elbow joint, so downwards. In case of a humerus it is downwards, towards elbow I go. But in case of a কি বোন এটা ভুলে গেলাম, radius and ulna, direction is upwards. Towards elbow I go. তাহলে in case of a direction humerus it is downwards. In case of a radius upwards. Towards elbow I go. Elbow দিকে নিউট্রিয়েন্ট আর্টারিটা যাচ্ছে। From knee I flee. From knee থেকে flee মানে উল্টো দিকে। তাহলে ফিমারের ক্ষেত্রে ডাইরেকশন অফ নিউট্রিয়েন্ট আর্টারি কোথায়? আপার। আর টিবি আর ফিবুলার ক্ষেত্রে লোয়ার। সুতরাং খুব ইজি মনে রাখা, টুয়ার্ডস এলবো আই গো, ফ্রম নি আই ফ্লি।